Okay, everybody, welcome to two podcasts. I'm Ashley Bessicker, and this is Cindy Kennedy. Say hi.
Hey everybody, how are you?
And we both have a podcast. Mine is the Crave Health podcast, and Cindy, yours is.
Mine is Living with Lyme.
And I actually kind of learned to podcast from Cindy. I was on your show a while ago, and then I kind of I'm obsessed with podcasts. And so then I was like, I bet I can do what Cindy does. So I remember calling you up and getting some like little details of how you do it.
Yep. I mean, it for people like you and I that are outgoing and kind of, not afraid to speak our mind or educate people. And I'll say it kindly. We like to educate people. It's not too hard for the person who's totally shy and fearful. You got to practice. So I think anybody can do podcasting, especially when it's not quite live. Like sometimes people cough or sneeze or whatever, and you can kind of edit that out. But generally speaking, it's just fun and it's really interesting to watch who's listening to you after the fact.
Totally. So yeah, we decided to do this little like co-podcast. So this will appear on both of our podcasts. And what we kind of decided to talk about was functional medicine and functional nutrition and what that is. And like how we've applied that. So for Cindy's listeners, I'm a registered dietitian and I work with professional athletes, and I haven't always, like I'll talk about how I got there. But it's nice to meet all of you. And then for my listeners, Cindy, tell a little bit about who you are and what you do.
Yeah, I am a family nurse practitioner and I am working in the functional medicine space right now. I have a business and a wellness center in East Long Meadow, Massachusetts. And, it's just a different approach, and it truly is necessary because our medical system is not really working too hard to reduce all the chronic illness. So that's kind of where I come in.
And so you're a family nurse practitioner, but where did you start?
Oh, where did I start? Well, as a nurse practitioner, after practicing as a registered nurse for years, I started in women's health. Love my ladies. Gosh, I love taking care of women. Lots of fun, lots of interaction. And it just so happened that I got sick. And long story short, I ended up having undiagnosed Lyme disease, and then later on a mold toxin issue, mold toxins. And so it's taken me lots and lots of years. And as I progressed and got better, I realized that mainstream medicine wasn't doing it for me. And if I didn't really try to figure it out myself and find better ways to heal, that I was not going to get back to where I was, or even better than I was.
Yeah. So you were trying to figure all your stuff out while you were practicing in like a women's health clinic.
Exactly. And then, the podcast came about because I knew that I could do something to help educate people. At that time, there wasn't a lot of credible information on the internet. You could find stuff, but you didn't know who these people were. It's not like today. Today, there's great leaders in the Lyme space and the functional health space. But back then there really wasn't, and you just didn't know. And I figured, why not? I'll give it a shot. I started local with local people, and then just, you got to be kind of persistent. I always try 2 times. If I don't get an answer, well, then I'm not going to invite you anymore.
Yeah. And so then, and your daughter, Kara, is a registered
Yes.
dietitian.
Yes, Kara is in practice with me. She is a registered dietitian, and because of just the way medicine can be delivered, she practices via telehealth. She lives out of the state of Massachusetts, but holds a Massachusetts license. So, we tandem. We work at, what's the issue? What's the problem? Let's get some particular testing. And then she addresses it with diet because, we really do believe food is first. And if we remove some really bad food barriers to healing, the body can heal. You might need some other support or other treatments, but the body can really work at taking care of itself.
And so your clinic's what's your name of the clinic again?
It's pursue wellness. We do a couple of taglines. Generally speaking, it's pursue wellness, an integrative approach to health. But the center is an integrative health center and spa, because we offer methods for detoxification. We have a really cool sauna, and we also have a far infrared mat, and we do meditation. We do great yoga. We have the only great yoga wall in the area. So it's an experience that no one has really had yet in the area. I mean, there's some in different parts of the country, but it's a strapping system, deep stretching, great for people who have maybe neck or shoulder or joint issues. And of course, things are opening slowly here, so we have to be careful. But we do have other practitioners, a functional health coach, and we also have a mental health therapist, and they're working via telemedicine. And our massage therapist is just waiting, for her full go ahead. And, we're just going to do it. We just, make it a community. Your vibe is your tribe, and you just got to bring it out there, and people will come.
Yeah. Yeah. For listeners, we're in July 2020. So that's what's happening.
Oh, yeah, true.
If you're listening to this later on, it is crazy. I love the new clinic. And I remember when you were jumping out of your like work day-to-day work job and you were thinking about getting into the space, I was like, go for it. There's a need. And so it sounds like you guys have a brick and mortar and that you do telehealth.
Yes, we can do it. We can do it either way. We have, with the changes that occurred because of the coronavirus, I actually got my independent prescribing license. And so that gives me free reins. And they, stopped the barrier of you had to have a license in every state to take care of people out of state. So, for right now, I have people out of state that I'm doing telehealth and helping them with a lot of people have gut issues, and that's only going to continue to get worse with all the anxiety people are dealing with right now.
And the amount of Purell and disinfectant people are using. Like, we're not being exposed to any natural bugs out there.
Yeah, and that's what they're saying about being at home, right?
Yes. And with telehealth, it's nice because I don't know how Massachusetts is, but at least here, insurance has released telehealth as being more covered, just because of all this thing. So that kind of like pushed everything through. Whereas before, at least here, it was like telehealth's not covered on your insurance. But now it's like you can do counseling. So my clinic still does counseling, therapy, and then nutrition and stuff. And so that's been really good.
Right. Because you have a whole clinic, and we've always loved the name of it. It's Crave, right?
Crave Health. Yeah.
Love it. Because it's such a play on words, isn't it?
Yep. It is.
Yeah.
Okay. So functional medicine. So I got into it a while ago, and my clinic, Crave Health, does practice functional medicine just like yours, Pursue Wellness. And it sounds like you have brick and mortar too. So we started off, I'm very conventionally trained. So I attended Pepperdine University, very like Bachelor of Nutritional Science. And then I went to Vanderbilt University, which is like very medical heavy. And then did my genetics and genomics certificate at Stanford. So like I'm very like conventionally trained. So when I got back to Seattle, I was thrown in with a bunch of people who were even though I was highly educated, I was very behind as far as just like alternative medicine or holistic health, or what they now are calling functional medicine and wellness, where you're looking at the whole person, you're doing a much bigger intake. You are like looking at root disease, what's underneath. And so I had to train myself in supplements. I had to take so much extra training, just kind of like you're doing right now. Which training are you doing?
So I've already done training with ILADS, International Lyme and Associated Disease Society. I've done some of their early on training. You can continue on, you can get preceptors and things like that, but right now all that's shut down because they don't want to shuttle you all over the United States. I've also taken a mentorship and training program with Dr. Darren Ingalls. He is a naturopath in California. He originally started in Connecticut, I'm sorry, Fairfield, Connecticut. So that is all, which I love, it's all on herbal techniques. And there's so many. So, you know, the training was super excellent. And I've just started in a full mentorship program with him. So there'll be a group of us. We'll always have access to each other, which is nice because notoriously you're going to have somebody that you're not really sure about that, you know, might be a little bit of a zebra. I've also trained with the Institute of Functional Medicine. I finished their applied functional medicine and clinical practice training, and I've now moved on to the School of Applied Functional Medicine. I'm in one of their semesters right now with a deep dive in hormones, which is, gosh, that's a basis of everything. You know, your whole hypothalamus, adrenal, pituitary, gonad, thyroid axis, except I have those all in the wrong order, but you get the picture.
Especially with all the stress, you know, that we have in this life.
Yeah, it's true. But you know what? It's unique, it's necessary. And somebody wrote something that I read. I deprescribe. You know, not me, but they do, you know, as they work in functional medicine, they deprescribe. So if you've got somebody on, you know, a statin for cholesterol, they work at getting the person reduced or off of it by finding the reason why. You know, there is so much insulin resistance out there, even with younger populations, and they don't have to be morbidly obese to have this going on. So, you know, I know you work with athletes and, you know, they're in tuned and they're knowledgeable, as well as they want to take care of themselves. You know, sometimes on my side of it, people are like, well, I can't give up gluten. You know, it's like, okay, well, if you want to have diarrhea for the rest of your life, then just continue to eat your gluten.
Yeah, you know, what I found is, so I work with only professionals, right? So I'm like working with the WNBA, the NBA, I'm working with the NFL, like I'm working with these athletes at the highest caliber. And so how that happened is so funny. Like I was running my clinic, Crave Health. I was doing like the one-on-one patient doctor type situation where we had an appointment, we went through stuff, they followed up a week later, like all of that. And then I had babies, right? And so that, you know,
It's only natural that you have babies.
Yes, I have a 6 and a 4-year-old, 2 girls. And so I hired a bunch of people at the clinic over time. So I have 6 dietitians, I have 2 mental health counselors, and I just really hired people that I love and trust. And I just kind of said, I have to step out and do this other chapter right now. And I don't want to close my clinic because it's amazing. It's helping so many people, well established in the community. Like we have all these networking connections. And so I was like, you guys, I trust you, just take over. And so while they kept seeing clients and running the practice and doing all that, it thrived when I left, because it, you know, it's not just about me, it's about like the teamwork and the good people and the connection between therapy and nutrition and emotional health and all of that. But towards the end of after I was thinking about going back to work after Gianna was born, my second, I was written up in an article because I do genetics, right? Nutritional genetics is kind of this like newfangled thing and people want to know about it. So I was written up in this magazine article, and a strength and conditioning coach read it. And she called me and she's like, hey, have you ever worked with pro athletes? And I was like, no, I'm not a sports dietitian. I'm like a deep biochemistry dietitian. I'm like a nerd dietitian. And she was like, no, we're kind of beyond the basics of pre and post fueling. And like these guys, they want to elevate and do some of the stuff that you're doing. Would you be willing to try 2 athletes just to kind of do what you do with them? And I was like, as long as they know I'm not a sports dietitian, like I'm not claiming to be sports. Like my stuff is totally different. As long as they know that, then yeah, cool. And she's like, awesome. So I'm going to connect you with them. It's Sue Bird and Megan Rapinoe.
And you're like, what?
I was like, I know Sue Bird because she's Seattle, but I was like, who's Megan Rapinoe? And she was like, first of all, it's Rapinoe. And second of all, she might be like more well-known than Sue. And so I was like, oh my God, I'm an idiot.
Well, you can't be everything and know everyone, you just can't. Depends, you would spend all day.
Yeah. So it's just started there. They obviously did very well. I had worked with Megan a year or two before the World Cup. And so clearly, if you watched the World Cup in 2019, you know that she did very well. And I worked with Sue the year or two before the Storm won the championship. And so she did very well. And Sue turns 40 this year. Megan just turned 35, 34, 35. And so they're these elite athletes that are wanting to kind of gain an edge later in their life. And so what happens is athletes talk on the bus and in the locker room, right? And so then what happens is like, I'll get a text at 9 p.m. like, hey, I'm on the bus with Sue and she was telling me what you're doing. Can you do that with me? And so then it just kind of snowballed from there. So now I maintain a private client roster of like 10 to 15 athletes, and I make them sign on for a year. Here's where the functional part comes in. I don't do
And you have to. And I'm learning that because if they're not committed and are you saying yes? You're saying yes, aren't you? It's the commitment. Show me your commitment.
Yeah. And you can't get anything done in 2 or 3 weeks. And people want a fast result. And people want me to just, oh, can you just run my genetics and give me a meal plan? And I'm like, yeah, I could, but it's not going to do anything. So if you want to work with me, you sign on with me for a whole year. We do genetics. And then we set up your meal plan for that. Plus my intake is so annoying. Do you have a really annoyingly long intake?
Yeah, I go as far as asking, how they were born, vaginal or cesarean.
Yes, because that has to do with microbiome. Yep, I talk about antibiotics on there. I ask them if they spit pink when they brush their teeth. I ask them like mold exposure. I ask them all these questions that they are like, why does my dietitian need to know all this? But functional medicine and functional nutrition has taught me that there's so many variables that play into somebody's health. And and then I do extensive blood work. So that's the other thing. Do you guys do a lot of blood work in your practice?
I do. I utilize as much of the regular labs, that I can do. LabCorp is a really big lab, but they're not in our area, so I don't have a way. So I can use Quest and I can use our routine hospital labs. So I do that. And then depending on their situation, we're either going to go after some first morning urine and do organic acids testing. So I can look at detoxification and methylation and amino acids and some vitamins and neurotransmitters. We can look at a lot of things that are metabolized and removed from the body. Because so many people have gut issues, a diagnostic stool that you get through your doctor at the hospital, it's minimal. It's nothing that you can get when you do a functional stool test, and the amount of information and showing the inflammation. And, this is new, and it's unfortunate that people ask me all the time, well, can I bill my insurance company for this or whatever? I'm like, they don't pay directly, but we offer super bills. You can go ahead and use things towards deductibles, etc. And for some people that's good, but you know what, it's all about, it's a little bit different. I see the people who are not well.
I was gonna say, people come to you, your clientele comes to you because they're frustrated and they're sick, right?
Exactly. They're sick and tired of being sick and tired.
Yep.
Right. If they came to me when they were where your people are coming to you, not necessarily that they had to be athletes, they wouldn't be coming to me sick and tired at all, because they would learn the importance of how to take care of themselves. No one is teaching that.
And it takes so long for this stuff to develop. Like, it's not like this stuff develops overnight. So what I tell my players is, if you come to me as a rookie, or even in college, you're not going to have some of the fatigue problems and injury. And you know what? There's a lot of gut stuff that comes up, and inflammation and things like that, that people find out when they're in their late 20s, early 30s. And that's still really young. You should be really healthy. Your lab should be awesome. But same, like you're saying, people think, okay, well, like, so I'm 36, and why would I get cardiovascular labs done? Or why would I think about my gut health? Because I'm fine. But, you know, it can start now, or even start 5 years ago, stuff creeping, and all of a sudden I'm 45 and I'm sick, or something starts to happen. And so it's that point that people are kind of knocking on your door saying, help me.
Right. You know what? I look at another portion is what's your toxic terrain, right? People don't understand that, you know, what you're putting in your mouth, from your toothpaste and your mouthwash, all the way through the food that you eat, all provide good benefits. But if you're not using the best for you, then it's going to provide some harm. Just like, you know, excessive exercise, you know, your athletes are putting out, and, you know, you got to help them detoxify all that stuff. When people are, and you can talk to that in a second, because that's always, that just blew me away when I learned that. Who knew? But when people are, you have to ask people too what they do for work. You know, I have people that have been sick or got sick, and it's, again, I was fine until, right? Well, you really weren't fine. Like you said, it was been creeping, it's simmering and whatnot. And I have a couple of people that have different set of symptoms, but when I asked them what they did, both of them worked with metals. One did HVAC. The other one, I'm waiting for results to come back. He works in auto body. So this is what happens. Metals love your brain. They love to hide in there. The skinnier you are, the worse it's going to be, because they'll be in your brain more. If you've got some, you know, central obesity or some big buns, then, you know, it can hide in there. But, you know, your environment is critical. And teaching people look at you like you have 7 heads. I never heard of that. What do you mean dirty dozen, clean 15? What do you mean? It's like, isn't that a hoax? Someone said that to me about, you know, organic kind of vegetables and fruit. Isn't that just a hoax?
Mm-hmm.
Isn't that just a money-making thing? I'm like, oh, nope.
I know it's hard for people to distinguish, like, what's fact and what's fiction, or what's noise and what's real. I get a lot of questions right now. I get a lot of questions about collagen, and I get a lot of questions about what's the other thing I get a lot of questions about? Intermittent fasting and
Yep.
autophagy and that kind of stuff. And normally people ask me, and I'm like, yeah, that's BS. That's BS. Like, you know, different things. But these two, I'm like, good research behind collagen, good research behind fasting and intermittent fasting. And that's interesting to play around with my athletes. But yeah, that's like our job, is to try to like educate people on. It's almost like there's a lack of critical thinking and scientific literacy happening. And
And you know what? Remember, all of the research is done by wealthy companies. So there's going to be missing data that you really have to use, you know, your analytical and your side that looks at, well, what am I getting as results, you know, anecdotally with these people? Because there are certain things that, you know, unless there's a pharma brand that's purchasing and, you know, supplying, et cetera, and making these things, there might not be some, you know, double-blind kind of peer-reviewed research on it. So I think that's where some of the things that you and I do, you know, primary care might not think we're, you know, they'll think, oh, they're just throwing, you know, supplements at people. They don't, you know, they're not really treating anything, but they don't understand that we don't want diagnoses. We want to remove that stigma of, you know, like, how many people back in the day, and they may say it now, I have the MTHFR. Like that's a it's like a red label on their forehead. I have MTHFR. Well, big deal. That's an easy fix. We can help you with that.
Yeah, totally. It's interesting with the athletes and then working with the team doctors. I found team doctors that are super cool, or team surgeons that are super cool and open. And then I've run into a lot of team doctors that think I am trying to like sell snake oil almost. And it's hard. I try to come at it with like empathy and compassion, and just um get to know me, know that I am not making money off of these supplements. All of my athletes, I hook up with a 50% off discount on all the Thorne products, because I have to only use NSF certified for sport products. So that limits my brands that I can use. But Thorne will give all of my athletes half off wholesale accounts, their own. So like I make $0 off of that. And so once I start explaining, like my goal is to get them on the least amount of pills possible, but you don't, like you just said, over exercising. And my athletes, that is their jam. They over exercise. Like they qualify as like too much exercise. They are completely depleting their vitamin and mineral stores. And that's what I use for blood testing. Some of them do have high inflammation markers. Their omega indexes are total crap. And the vitamin D is so low on some of these athletes. And every time the muscle contracts, you use vitamin D. So imagine if you're a Seattle athlete, or New York. I consult for the New York professional basketball teams. They don't get sun. We don't get sun. So you're already depleted in vitamin D, plus you're a pro athlete, and you're not going to know what that level is unless you pull a blood test. And so it's been interesting for me to try to convince doctors to like what the validity is of all these pages of blood work that I'm showing them. Some of them are great. Like I like to get baseline markers. Some of their hormones are awesome. Some of their CBCs are awesome. Some of their inflammatory markers are perfect. But don't you want to know that before throwing stuff at them? Or if their vitamin D is too low, I'm going to have to pump that up until they get optimized, and then I can bring it down.
Right. And then the fight over these labs, their markers are like normal starts at 30. It's like, that's not really optimal. Yeah, the lab is going to say that, but that's not optimal. And we know that too low, or certainly way too high vitamin D, actually suppresses the immune system. So we have a sweet spot for that. And vitamin D is not just a vitamin. It really acts hormonally within our body. It's so critical. Yeah, somebody told me the other day that they had asked their regular doctor for a vitamin D level, and the answer was, why do you think you need that? Like the sarcasm and the in their face. Why do you think you need that? Come on, get with the program. What rock are you hiding under?
Same. I have so many people tell me that. And just for fun, like a year ago, my colleagues can order any lab they want on me, or my other functional medicine docs that are around me. I have all my labs that I keep track of. But just for fun, I asked my like general primary care physician that I go to when I'm sick, can you pull my vitamin D? Because I knew that they didn't have an updated vitamin D. And I love her, but she was like, insurance won't really cover it, and it's really expensive. And we know that you're going to be low anyway, so there's really no reason to pull that. And I was like, interesting. Okay. Well, and then I just said, okay. And I walked out, and I was just like, I just wanted to test for myself what the docs are doing. And so most of my athletes panels now, the teams do physicals and kind of some basic blood work. Most of them will include a vitamin D now, but just the fact that patients have to first be educated themselves and know why it's important, and then have to ask, and then have to fight. It's a bummer.
It is. You really want to feel that you're in good hands. Someone's really looking out for you. Yeah. Not saying that you or I are the most important, but your patient should think that they are.
Yeah. And it's so important to collaborate too.
It takes a village.
It does. Not everybody. I don't have all the answers. And you don't have all the answers, and the team doctor doesn't have all the answers. And so everybody needs to kind of come together, and that's where like therapists are really important. And like you were saying, you have massage therapists and like these other things. I feel like everybody should have this like medical community around them that all knows what's going on and is connected and knows what's happening, because they also are getting conflicting information. So that's kind of half my job actually, is like looping in the athletic trainer with the strength and conditioning coach, with the team doc, the making sure the chefs know, or like half my job is coordination. But it makes the player feel loved and supported, and like people know what's going on.
So you're like an event planner now.
Totally. I am.
Totally. You know what? I want to give you a pearl. I bet you already know this, but I want to say it so I always remember it. Because of the stress and strain on an athlete's body, they end up having more chances of gut issues simply because they produce more zonulin. And zonulin weakens that semi-permeable kind of membrane within the gut lining. I was like, that is so cool to know.
Okay, so I haven't looked at the zonulin specific variable. What I do see is lots of complaints of gut issues, and I have found a shocking amount of SIBO in my athletes.
Yep. Now people have bacteria, good bacteria, where it doesn't belong. Yeah. A gassy athlete is just not good, is it?
Oh, and just the fact that they've lived with diarrhea or constipation or bloating for so long, that's all they know. You know?
That's not a good way to be, that really isn't. And thinking about people who are not necessarily professional athletes, but people who are weekend warriors, and now everybody's out. The safest place to be if you're not with your family in your home is out in nature. And my mind keeps going around and around thinking, okay, are people doing tick checks? So, when those weekend warrior athletes are, out with their family and they're combing through the brush, or they're gardeners, they're just in their backyard, but they're, removing brush and leaf litter and things like that, I'm concerned what's going to happen either, later this summer or really in the early fall. And one of the biggest, and it's very sad, is children often present with neurologic findings. So it's really important for people to know that if your son or daughter is, 4 years old and they've been wonderful, and all of a sudden you're like, what happened to them? They're defiant and their behavior is off and they can't concentrate and etc. You have to think about this. And this is yet another issue we have with mainstream medicine, because they assume that the testing that they send at their, regular hospital lab is reliable. They don't understand that it's very poorly reliable. And so, that's just a thought. And, tick checks, and even for your athletes, to be honest with you, any of them that are, on fields, etc. I mean, stadiums should be a whole lot safer, but anyone else, everybody's at risk when they're outdoors.
Yeah. I have one athlete who's retired from the MLS, and he got into, after MLS, just that competitive spirit, started doing, what are they called? Like crazy, like 100-mile runs, like
triathletes.
It's extreme marathon.
Oh, extreme.
It's like, there's a word for it, and I'm going to think of it.
Crazy?
It like 100-mile runs in the middle of nowhere. Like it takes 24 hours to complete the race, and you're running around mountains and through, like he actually had to stop and take a power nap in the middle of the forest during one of these runs. And so like for somebody like that too, it's like, you got to start, that's something you've never had to think about, right? On a turf soccer field. But then now you've switched your athletics into something else. And I actually have on my intake form, have you ever experienced a tick bite? Or, do you live in areas with ticks? And a lot of people are like, why do you need to ask that? And I'm like, it is significant. I need to know if you have. How do you perform a tick check?
So it's basically you know, if you have a child, obviously you really head to toe. What I tell people to do is if they've been outdoors, that immediately coming into the home, you leave your shoes outside, but coming in, everything off, right down to the underwear, put it in the dryer on high for 10 minutes. It will kill a tick. Some people just will take their clothes off and throw it in the hamper, and then figure when the tick goes through the wash, if there was one, they'll die, and they won't. They only die in heat. And then you just, you look and remember, some of these ticks are the size of poppy seeds. So it's like, oh, and you have to comb the body. You have to look between fingers, between toes, in the groin, in the armpits. We've seen them burrow into belly buttons. So it's just critical to really evaluate. And then I tell people, into the shower, head to toe showering. That has been shown to actually reduce the incidence. It's the people who are doing all this outdoor stuff or hiking, and they come in and they're lazing around, or, they're staying in all their clothes. And, one mom was so saddened by the fact that she did not bathe her 18-month-old the night before, fell asleep. So just pop her in the bed and whatever, and woke up the next morning with, a tick on her back of her calf. And but you know what, when you find a tick, you put it in a plastic bag, whether it's dead or alive, and you can send it up to UMass in Amherst, Massachusetts. It's called tickreport.com. They are back up and running, and they will test your tick. You can pick what you want it tested for and where you are, because obviously the Northeast versus the Western Pacific area, South Pacific, wherever we are, or, the southern part of the East Coast, there are different types of ticks in different areas. The problem being is that they're migrating because they're on birds, and birds, don't have barriers. They can go quite a distance. So we're finding different ticks in different areas. So there are some labs that I work with, and they're really neat now because they do finger stick testing. So you actually do your pick at home, and you fill up, some areas on a card, and they can test for a tremendous amount of things. And I think that's great with kids. I mean, it doesn't feel good to pick their finger, but, bringing them in and having their blood drawn, that can be even more anxiety provoking. But so that's what you got to do, and it's diligence, it's vigilance, because Lyme disease is no joke.
Do you baseline test on all your patients? Do you do that for baseline, or only when they present certain symptoms? Like, so let's say I have an athlete, like what would I look for, and how would I utilize that, or like have that pop into my mind as something to check that box?
Yeah, I mean, unless you were sending out to specialty labs, which costs out of pocket, it's a lot of money. No baseline stuff. Lyme disease is also known as the great imitator. So people can come in with kind of roving joint pain. They could come in with headaches. About 100% of Lyme patients have some sort of a sleep disturbance. They can be excessively fatigued. They can start off with, GI symptoms. It's a variety of certain things. A lot of people will say, I just feel so fluey, or I don't know. And it can be anything. So you really have to think it through. When did this start? Was it abrupt? Have you been with anybody else? Anybody else in the house feel this way over the course? And it's not necessarily, what did you do in the last 2 weeks? You have to go back, because some of these things, especially if you don't see a bullseye rash, which happens in less than 50% of the cases, then you really may not know when that bite has occurred. And it's that terrain kind of thing. All of a sudden, you've got symptoms, but your body had been working really hard to suppress things for so long that something tipped the scale. Could be stress, could be, abuse. It can be, some other surgery, or, you name it. And if that happens, the body's immune system can become not so good. And then all of a sudden you end up with symptoms of Lyme disease. So
And can that happen over years?
Yes. Yes, it can. Yes, it can. The symptoms can come and go. It's like, oh my God, it was a mess for a weekend, and then I'm pretty good. I don't know what happened. Must have been some virus, because we blame everything on viruses.
I know.
Well, right now we can blame everything on a virus.
I know. Well,
But yeah, yeah. I mean, being open to it, even just having that as a thought,
yeah.
you're a hell of a lot ahead of general medicine, because I've been told this politely, and sometimes not so politely, that it's a bacteria, and 21 days of an antibiotic will take care of it. And that's really not true. The research definitely backs up the fact that this, spirochete then changes its shape, and it houses itself in a cluster called a biofilm. They come and go. They're active at intervals. And so, it's not just that 21-day kind of antibiotics that really work. That's why I really, really, really believe very strongly in herbal remedies for this, and they're safer, and they don't necessarily totally disrupt the gut. And that's where a good 80% or so of your immune system begins. And your gut also produces 90% of serotonin, which is one of those neurotransmitters. And it's a critical place to make sure that it's really in good shape.
What are the herbals you like to use for some of the biofilm stuff?
Yeah, so I love research nutritionals. There's a few companies that have kind of very similar, so I always have to think it through. And they have a triple tincture that covers so much, and you really have to kind of look at the person, maybe their labs, and figure out. For some people, I just rotate the 3 tinctures right through, and everybody's different. So, sometimes people say, well, how long? And I'm like, well, I don't know yet. We're going to go through there. They have wonderful binders. They have wonderful, off the top of my head, I can't think of what their biofilm buster is, but I believe, I want to say, nattokinase. I'd have to look that up. Don't quote me on that one but there are several of them, and they have a brand new product called Toxin Pull. So that will pull out metals, it'll pull out mold. There's a wonderful product that's very simple, easy to use, called Pectisol C. It's modified citrus pectin. And so if you need somebody you just worried about a little bit, you want them to have some sort of a binder to help in their gut, that's real simple to use, really tolerable, and it's great. I really do like that one too. So, there is a couple of companies that actually did not make it through all of this craziness. But when you're looking at, there's other people like Byron White, Stephen Buhner's protocol, which is Japanese knotweed and cat's claw. Those are really effective. But I do like the one from Research Nutritionals, because it's combination. You're getting more bang for the buck. Instead of having one type, it's got multiple different things. So it helps across the board.
So I have to do more research on this, but because of NSF sports certification, I know that the one that is NSF sports certified is Atrantil. How do you feel about that one?
I don't know that one.
Okay, maybe I'll send it to you for your.
Yeah.
But sometimes when there's when there's a diagnosed SIBO with an athlete, I can use that because it's NSF certified for sport. Because it's hard, because a lot of the herbals and some of that stuff, a lot of the vitamin B12 and vitamin D and a lot creatine and all that stuff.
Oh yeah.
Certification, but some of the more effective functional ones it's so annoying because I can't use them unless they're certified, and the company has to pay an extra and have a lab audited to get that NSF sport certification. So as far as I know now, and if any of my listeners know, if there's an NSF certified for sport, like one that you're talking about that's not Atrantil, let me know. But I usually get good results with that.
What's in it?
It's let me look it up. It is.
because for gut healing, general stuff like things like marshmallow root and licorice and what else? You know, glutamine is a really good one, but I bet you that might not be, because there's some kind of crossover stuff a little bit, not fully with glutamate, which is, you know, kind of a higher mental status kind of thing. People who are generally genetically high glutamate are those people that are, you know, the type A, and they got to finish everything and they got to do everything and they're really smart. And
Okay, so Atrantil is, oh my gosh, quebracho extract, QUE bracho extract, horse chestnut, and peppermint leaf.
oh, horse chestnut, huh?
Yeah.
Yeah. So they don't like marshmallow root, I guess, right?
Yeah, or maybe there's some sort of,
Yeah.
they couldn't get it certified. Anyway, I'll send it to you.
Yeah, I've never heard that company. That's neat.
With sport certification to see if there's any other companies on board. But yeah, gut stuff is a big deal. Bloating. And with my genetics, I can automatically do gluten-free or lactose-free. Like those are genetics that have enzymes that I know immediately which athletes need to be on a gluten-free diet or a lactose-free diet.
I'm just having, it's ANTRINIL.
It is
ANTRINIL.
ATRANTIL, Atrantil.
Yes, you know what? I think I know of that actually, because that's wicked helpful for the gassy part of it and bloating. And I just looked at it and never really pronounced it.
Covers some of it, but then, you know, there's so many crazy things that happen in the gut. You have to attack it from so many different angles, and that probably does one of the angles. But yeah, I mean, I think a functional approach is really important. I hope that more medical providers, whether it's just general practitioners that you're dealing with or team doctors that I'm dealing with, become more open. And what we face is that there's a lack of double-blind placebo-controlled studies that have been replicated. There are some, but using, you know, clinical experience, using and looking at the pros and cons to try this. Is it going to hurt the client or interact with anything? If no, and it's safe, why would you not go there? You know? And so I'm super happy that, you know, you're on the other coast. You opened up a clinic that does this. You're networking with people. You're talking to doctors. I'm on this coast doing it. And so the more of us that are out there doing it, the better, because then word spreads.
Right. We're going to be like the Betsy Ross of, you know, the beginning of something good, you know, that did something and everybody's going to remember. Maybe not our names, but, you know, it's not, yeah, in certain segments of the country, it's really big, and other areas it's newer. And I think we have to have patience, and I don't mean people patience. I just mean patience as in terms of, you know, waiting it out and whatever. I don't find I have any luck with primary care in this area, not at all.
And that's the other thing. People are, you know, that clients need to understand, and people who are exploring this for themselves, and doctors, like, this takes time, which is why you probably don't also like to see people 1 week and 2 weeks. I mean, you probably are doing follow-ups for months, and I require a year-long sign-on because I want to test those labs after 3 months or 6 months or 12 months, depending on what was off, and see how the protocol we've implemented is actually working. And people tend to get so frustrated. Oh, I tried that. It didn't work for me. Well, consistency over time is where health happens. One salad isn't going to make you healthy. One burger isn't going to make you unhealthy. And just like we were talking about, Lyme disease and these other things, they creep up over so many years. Same with cardiovascular disease.
Right, right. And the thing is, it's in the family. Do you get that a lot? It's in the family. I can't avoid it.
Yep. And
do you still do a lot of genetic work?
I do baseline on everyone. I require it now. I just built it into an annual fee. So I just have one big annual fee and it covers everything. And sometimes I have a client that's like very complicated, or there's a surgery or an injury and a lot of time goes into that. And I really don't like the business metrics don't work out. I probably didn't charge enough for the time I put in for that client, but then it evens out because there's other clients that are baseline pretty healthy. There's a few little tweaks and there's not a lot of hand holding because they're coachable and they're a pro athlete. So I feel like it evens out in the end. So that's how I do it. But I do work in the genetics with everything.
Yeah, I think there's a big benefit for that. Some of it can get really complicated, you know, but the great stuff that works with diet is some things everybody should have.
And I find even if there's, even if I get genetics that there aren't a lot of like crazy red flags, they're pretty common. They've gotten most common variants. There's nothing shouting out, you know, that we need to know of. They're not gluten sensitive. They're not lactose intolerant. They don't have a predisposition to blah, blah, blah. It's still such a motivating tool for people because everybody knows what to do. Everybody knows more fruits and vegetables. Everybody knows you need less junk food. Everybody knows you need to move more. Like, but why aren't the majority of the population doing it? Well, because they haven't been told it's about them. There's nothing that's, you know, there's nothing that really hits home. And so when I tell people this is your biochemistry, this is how your thing works, and this is what's going to get you around that pathway. So let's say vitamin A or something, or choline, or you know, this is why you're not a good candidate for veganism. This is why you are going to require a red and yellow vegetable every single day to support your vitamin A pathway. Or this is why you need to eat the yolk of the egg and skip the egg whites. You know, it's like there's little changes that over time, based on their genetics, I can say, doing this one little change consistently, it just motivates them. Like they know they need to eat more vegetables or more fiber or whatever it is. But if I show them something that tells them why they need to, it's worth it just even as a motivational tool, I think.
Yeah. They like to see it. They like it in black and white for the most part.
And
it doesn't leave anything open for interpretation.
And I have had to learn to not geek out so much because the science can be really overwhelming for a lot of people. Try to.
Yeah. But again, you know what? The way everybody has grown up, medicine is problem, prescription, and short term, you're going to feel better. And people are busy, and you know, anything new is almost so overwhelming to them that it's just give me something, you know. And that's where you and I and our ability to counsel and, you know, console these people that, you know what, I'm here, but we're going to be here for the long run. This is not a one and done kind of thing. And a lot of people, you know, that's why Kara and I work with packages just like you do, because if they're thinking one visit and I'll decide or whatever, it just doesn't work. And if you can't commit, then you're just not ready. But we tell people, you know what, we're not going anywhere. And when you feel ready and you need that support and guidance, we're here.
Absolutely. So what is your ideal client that you would like to come in and see right now, and how do they find you?
Anybody that has ongoing medical issues that really have not improved. So like I said before, we do see Lyme people. We work a lot with gut issues, you know, the same thing, the small intestinal bacterial overgrowth. We have people that have autoimmune issues, and of course, you go right back to the gut, got to heal that gut up. Thyroid is big because in the medical literature, all they're telling you to do is check a thyroid stimulating hormone or a TSH, and no one is really looking at the independent thyroid hormone levels. And the problem with that is producing it. Go ahead.
No, I was going to say T3, T4 antibodies, that tells the whole story. And there's so much pushback on why to order those. I order everybody.
Why? I don't understand. So yeah, so those kind of type of people, sometimes we'll get people with fibromyalgia or really bad allergies. And again, allergies goes back to the gut because that's where you produce your DAO, which helps break down your histamine. A lot of these things, and just trying to teach people how to eat better. It really is, and I tell people, I might be counseling you, who's the mom or the dad or whatever, but you can bring this right back to your family. You can make everybody in your family better simply by this, and people just think they're going to need 1,000 supplements for the rest of their life. And it's like, no, you're in the treatment phase. Oops, sorry, there's a tail. Darn it. But yeah, that's, there's a certain number of people who Kara works great with, some of the hormonal things, and she does some Dutch testing. The other thing is, one other thing. Migraines. We find a lot of food sensitivities. And of course that goes right back to the gut again. So, it's everybody's different, but yet everybody's under a gut umbrella.
And they can work with you via telehealth. And where do they find you?
So www.pursue, P-U-R-S like SAMUE, wellness.us is our website. We're actually in the process of developing a brand new website, but we'll have all that information on there. There'll be links to the Wellness Center for anybody that is thinking about some method for detoxification. For anybody that wants any other additional information, they can give a call to 413-526-7990. Oh, I'm so proud of myself for remembering that.
Are you guys still doing the discovery calls, the free ones?
Yes, we are. And you can get a link to that right on the website. Yeah, we just like to talk to people. We want to make sure that they feel comfortable with how we do our thing. And, maybe we're not the right people for them. And we're not going to take people who we don't feel we can really help, but we'll help them find the person that can help them.
Yes. And I think that's what I love about you guys. There's a lot of practitioners that are just trying to make money and that are just trying to sell you a bunch of stuff, but you guys have such good hearts and you're coming from the right place. You're truly just trying to support and help people as much as possible. And I think that's what's so great about healthcare providers, is like we're coming from a place of love and healing and wanting to help. And then just some of these other bad apples make people skeptical. But I can tell who is ever listening from experience, Cindy and Kara are awesome. And it's so nice that you can get a free discovery call on their website. So any of my people that are listening, please do that.
Oh, thank you. Thank you. I appreciate that. Yeah. Certainly we can help a lot of people, even things that I may not have mentioned. The newest statistic is a face-to-face talk with a primary care doctor is 7 minutes. And what can you accomplish in 7 minutes? We spend about an hour and a half in terms of our initial visits, each of us, and our follow-ups are always an hour.
Amazing. Amazing.
Yeah, thank you. Thank you. Appreciate it. And I'm so excited to hear of this great adventure. Now I know who to call for tickets to certain games.
I know, right? Interesting. My clinic, Crave Health, is still running. But I don't work there anymore, which is so weird. So I'm in this like branding issue problem because like this is the Crave Health podcast that I've run and my emails at Crave Health and I'm on the Crave Health website, but I do something totally different anymore now. And so I coined the term because there was nothing that explained what I did with athletes. So I coined the term functional performance nutrition. I think that like kind of embodies what I do.
That's really good.
So I have a new website and I'm working on thinking about rebranding kind of me and what I do. So my website's just my name, www.ashleybesecker.com. It's BESECKER. And who I'm looking for, so unfortunately with my time and how much time I spend with, my clients, because I do a functional approach, I only take on 10 to 15 athletes per year. And those vary, right? So somebody might start in April and end in April or, whatever. So I have a little wait list that I just rotate people onto. So my ideal client would be a professional level athlete. In an ideal world, a rookie, because I can take a rookie and set them up all the way so that they are like Sue Bird and they play till they're 40. So that's an ideal patient for me. And then just somebody who wants next level stuff. I give them, I say, catch up and get to the Nancy Clark sports nutrition level. Do you know who Nancy Clark is? The like,
No.
she's like the famous sports dietitian. I'm like, if you can read her book and get to that level, that's basic sports science. I'm next. So if you're ready for like next level, that's me. And then I'm consulting this year for the New York Liberty, which is a WNBA team. And so that's been fun to work with a team and a coach. That Walt Hopkins is the main coach. He's awesome. And so I'm looking forward to working with that team. Sabrina Ionescu was the #1 draft pick this year, and so she's on the Liberty. So I get to work with.
Were you ever very athletic? Knowing names and whatnot. I guess I could answer that, but now it's a whole new world for you, right?
So I was an athlete, but I did like volleyball and softball, and I was an athlete through high school, and I've always been very athletic. Like I hold the speed record for home to first at my high school and around the bases at high school. Like I'm athletic. And so I love sports. I never played at like a college or a professional level, but I love the logistics of sport, but I'm actually pretty bad with like names and teams and figuring out who's in what position in that. Like, I just love sitting down and watching a baseball game. Like, I love the logistics of like, okay, so you have a runner on first and here's up to bat, or watching a soccer game or watching a basketball game and seeing how they move and play. Like, I just love the logistics of sport, but it's my husband, he just dies. I asked him one day, I said, hey honey, do you know who Gino Ariyama is?
Yeah, he's a coach. And he was UConn, right?
Yes. Okay. So, and I was like, and he was like, Ashley, are you kidding me? He's like, you work with WNBA players and you don't know who Gino Ariana is? And I was like, no, I'm sorry. Like, I know UConn and I know that they're like half my players went to UConn. Like, I know it, but I'm just bad with the name. So part of my goal is getting more into like the fandom of the sport versus just the play.
Yeah, well, it's just like functional medicine. It takes time, right?
That's right.
Oh, I'm so glad you told us more about you and how things are going for you. And it's quite an amazing journey that you have had, all the way back to, oh my God, what do I have to know? It's not about macros and micros. Oh my God, now what? And finding your niche. This is now a niche for you. And this is actually a great place to be. So I'm real happy for you. I don't know how many professional athletes I have, but I think that's cool. Do you work with the Arizona Diamondbacks?
No, but I do know the some of those strength and conditioning people and dietitians.
Okay, yep. I happen to know somebody that was in school with one of my children who plays on that team.
Yeah. I have an MLB player actually. If there's any baseball players listening, I want to see how you compare physiologically to some of my basketball players. I like comparing body types because the sport and the physiology and the training and stuff is so different between sport, right? Like my NFL center is different than my female soccer player. And so I want to see a baseball player.
Okay, we're going to find one for you. This has been really lovely. It's been a nice way to share our common goals, and that's simply to really help people and
Yes.
provide that support. And it's just so nice at the end of the day to really know that you've made a difference. And even if you're working on making the difference, it's still helpful.
Yeah. Well, and I love collaborating with you. So thank you so much again.
Oh, you're welcome so much again. This has been really cool.
And let's do this again soon.
Absolutely. You
Okay,
just give me a call.
thank you. We'll talk soon.
Okay, we will. Thanks everybody for listening to Living with Lyme podcast and Crave podcast with Ashley Vasecker.
Yes. Thanks, guys.